find out how do we actually treat this stuff? Yeah, I bet. That's the thing with Chinese medicine. Sometimes you can just go on and on about theory and ideas, but where is the bones? Where is this actually going? What can we actually do here? And that's something that's really near and dear to my heart, is really how do you do what you hear about? Like, how do you treat these things? That's why I've been gravitating towards many teachers who work specifically in that way to apply it. It's all about applying this knowledge, because, I can talk all day long about how great, something works, how this is, but until you know how do we actually treat this, how do we work this in the clinic, that's where I think it really makes a difference. So we're going to talk about 3 different stages. Now, this is just an approach. This is not the only end-all, be-all approach. This is an approach to treating emotional trauma. I like to actually move around. I feel very stuck, having to be stuck by this podium. I wish I had a roving mic, because I love moving. Why? Because I'm fiery. So I was like, why? I was like, I don't like this. So if it gets too quiet, though, please tell me, and I'll jump on the microphone, okay? So the idea is working with these different stages. I really like, I just encourage you guys to try these approaches. If it works, great. If it doesn't, throw it away. Like my Qigong teacher, Master Zhang Shen Wu, says, he teaches Qigong. Try it for 49 days. If it doesn't do anything for you, throw it away. There's no use for it for you. He teaches me the different forms he knows it works for him. If it doesn't work for you, throw it away. If you try this on your patients, doesn't work, fine. But I'd encourage you guys to at least give this a shot. So there's 3 stages I talk about. The first is gathering the qi, and that is really thought of as mothering. So in my practice, I do like to think about the roots of Chinese medicine, which are shamanism. So 80% of Chinese medicine, roughly, comes out of shamanism. So shamans would think about the idea of working with Mother Earth, working with Father Sky. How do you incorporate these energetics into the practice? How do you bring them into your clinic? So this is the idea of mothering someone, helping them to feel safe and secure, because they've just gone through a major shock. They're thrown everywhere. Got to help them get back to center. So that's the first stage. And we'll talk about, how does that look in terms of treatments, different modalities. Then the next stage is soothing that trauma memory. For those of you who weren't here in the first half, we talked about the different physiological effects of emotional trauma. There's this initial event. It scatters the energy. The pericardium tightens. The shen wants to leave the body. The qi becomes disordered and blocked. And then that trauma memory surfaces. You might see something, hear something, smell a certain smell. Oh my gosh, that perfume reminds me of my ex-wife. All of a sudden you're charged and back into that really intense divorce or whatever. So this is the idea, is helping to soothe that trauma memory, because it's creating heat. There's heat surging. You're seeing heat on the face. You're feeling heat in the pulse, heat in the tongue, feeling those channel changes at pericardium and heart. And there's those winds coming. So we want to settle all of that down. Then we go to the next stage, which is working with, so that, by the way, the second stage is fathering. So the role of a father is to help help the child feel safe and secure so he can go out into the world. It's giving them encouragement, giving them that confidence that they can move forward. That's that yang energy. Now, fathering is just in quotes, really, because it can come from anybody. It can come from female or male role model. It's just that idea of helping someone to have that confidence to move forward. That's like the fathering, tune in with Father Sky energy. Then the third stage is really helping to find that balance between heaven and earth. Helping someone get their channels together, helping them get their organs nourished, making sure there is that harmony between the heavenly energy and the earthly energy. And that's really differentiating and working with those individual imbalances. And that's going to really vary for each person, but the first 2 stages are pretty generic because they're working on the overall bigger picture. Is it okay back there with the sound with me? Okay. So this first stage I call gathering the qi. So what we're doing is literally gathering the qi. It's been scattered. It's gone in all sorts of directions, so we want to help bring it back to center. So we want to help them feel safe so their spirit comes back into the body. We want to make sure that their earth element gets back into rhythm. The E, what is the E about? The E is about processing, right? Processing information. The E is about helping to make sure someone is able to stay in that rhythmic motion. The earth element is going in rhythm. Well, that's just been scattered. So we want to get the earth element back into that rhythm. And we also want to help with regulating the chi in the blood. So that's another aspect that we're thinking about. And so this is really mothering, helping to stabilize them, helping them to feel safe so they can start processing. Just like you saw those pictures of those people when they came in, they're pretty scattered. Their energy's going every which direction, and they have no way they can start processing the trauma. They're just trying to get, trying to make it through their day. But once they feel that safe, security, held feeling, they feel safe, they feel like, oh, I actually have the ability to be still, to now process that trauma. That's what we're going for. So through working with my teachers, working in the clinic, over the last several years, over like 18 years of working with people with trauma, I found a point combination that works very well to work on these levels, to work on that earth element, work on stabilizing the body, helping someone to feel mothered. And there's 4 points. These points are pretty big picture points. We're talking about Yin Tong, MHN3. We're talking about Neguan, pericardium 6, Zhongwan, CV or Ren 12, and Sanyan Jiao, spleen 6. These 4 points are what I'm using to help gather the chi. Gentle stimulation and keeping it very simple. So I want to go through each one of these points and talk about why they're helpful for this initial stage of gathering the chi. So beginning with Yin Tong MHN3, this point, as we know, is on the third eye area. It's traditionally, it can be looked at as the seat of the stamp or the Hall of Seals. The Hall of Seals, what does that relate to? So in China, you guys know about the chops, the signature stamps, those red little chop things. And then, put them on artwork. They would seal envelopes with these. Well, the higher you were in ranking politically, the bigger your chop. So, of course, Emperor's chop is this gigantic chop, okay? It's this huge seal. It was stored in the palace in this one room called the Hall of Seals. And the room looked out over the entire city. So the point is the emperor be able to sit in that area and look out and see the bigger picture. So this point, when you're activating it, helps to get you into that perspective, see the bigger picture, not be trapped in that drama, not be trapped in that story, trapped in that old memory, or trapped in that scattered state, but to be able to see the bigger picture and then start to see what it is you need to process. And I've seen this time and time again, all those different pictures. We'll talk about some of the cases in a second, but how people do get that perspective and they get that aha moment, that clarity. Now this point calms the spirit, we know that. Yin Tong calms the spirit. It also, where it's located, is near the prefrontal cortex, is right by the frontal lobe. There's been studies done in China activating this point along with a couple other points that enliven the prefrontal cortex. It improves the communication. Why is that important? Because remember I said when that prefrontal cortex is working correctly, it's going to check the limbic system and say, wait a second, you're not in that 20 years ago trauma, and it'll communicate clearly. So it helps with that aspect as well. By the Lillian Bridges facial diagnostic system, it's located in the liver area. Why is this helpful? The liver is the general of the body. She tells the blood where to go. If the general is confused and scattered and not with it, it's not going to be able to command the blood where it needs to be, and so then there's no longer that nourishment to the channels, there's no longer the nourishment to the organs. So by getting the Jue Yin strengthened, it can help improve that. Now, how I needle this point is actually a little bit different than the location traditionally between the eyebrows. I use a point that's slightly above it. I just call it Yin Tong because it's an easy one we can all grab onto. You guys know Yin Tong. But where the location is actually a little bit different. It's 0.3 Tsun above Yin Tong. Okay, so Yin Tong is between the eyebrows. It's 0.3 Tsun above that. The needles that I use in my clinic, I typically use sarin needles for the body. I find them easier for the penetration, easier so it doesn't cause as much discomfort, and it's very gentle. For the face, I usually use a 36 gauge needle. Bless you. And I'll put it in and thread it down. So it does pick up yin tong, but this point is called Jen Jing. It's a Master Dong style point. You guys have heard of tongue style acupuncture? Probably. Yeah, so this is from my teacher, Dr. Wei Che Young, who was a direct apprentice who studied with Master Dong. It's actually pronounced Master Dong. People say tongue. Master Dong for 20 years. And this point is incredibly effective to help with anxiety, with all the host of emotions that can come along with emotional trauma. So again, it's 0.32 and above. I'll thread it down. And this point by microsystems relates to the heart area. So it also helps to benefit the heart. Yes? Right. So I just say yin tong because we all can jump to that point, and that will be a fine point. But to make it even better, this is kind of like a hidden hook, so to speak, for all you guys who are here. It is in the book too, but it's just going a little above that point. And I find it very helpful, and it has an extra ability for calming and an extra ability to benefit the spirit and to help bring the spirit back into the body. The next point is Neiguan, pericardium 6. You guys have heard about this point a zillion times, but there's many reasons why this is a helpful point to deal with that initial stage when the energy is scattered and the pericardium tightens. Of course, working with pericardium 6, it's going to help to regulate the pericardium. So then the emotions can be more regulated to and from the heart. It calms the spirit, we know that. We know that pericardium 6 connects to the middle jiao. You guys have used this probably many times for morning sickness, motion sickness. It connects to the middle jiao. So again, it's helping to benefit that earth element to ground and center someone. Get the E back to processing. Get the ability of the body to be back in rhythm. Because again, when the E is strong, it can process that old trauma. It's on the Jue Yin channel, so again, here we go again with benefiting, sorry, I'm kind of in the way here for some of you guys, but benefiting the ability of that general to make decisions, to regulate the blood where it needs to go. And most importantly, it's the confluent point or the command point of the yin way, the yin linking vessel. Now, the yin linking vessel, from what I understand from my teacher, Dr. Wong, it has the ability to irrigate all the channels and spaces, all the organs. So it's literally able to nourish all the nooks and crannies of the body, all those little areas that when you get that scattered energy, the body is no longer able to be nourished properly, and so this helps to nourish all those areas and get the body back to feeling held and centered. Now, the location at this point, you guys probably have heard the textbook location. It's Tutsun above the wrist crease, okay, proximal to the wrist crease. Where I find it, and Dr. Wong found it, and Dr. Wei Che Young finds it, is specifically proximal to the second vessel. So you guys can hopefully see this. There's a vessel here going across those tendons, and there's a second vessel going right there across those tendons. It's just proximal to that second vessel. So you guys can even look on your own wrist and see if you can notice that second vessel. Sometimes it's not exactly Tutsun above. It might be a little bit less or a little bit more. But this location, it was very important to Dr. Wong. It's very important to Dr. Young. This is where Master Dong would find it as well. And if you want to get very specific, it's on the radial aspect of that space between the tendons. Does that make sense? Let's say we have your two tendons. Here's your thumb over here. It's just a little bit closer to this tendon than this tendon. It's not directly in the middle. This might seem very specific, but Dr. Wong emphasized this many times when I studied with him, and Dr. Young did as well. So I thought I would just mention that as an aside. But you know, pericardium 6, but this is just another aspect. So when I do this needling, I actually use a little bit thicker gauge needle. I use 34 gauge. And the sensation is very gentle. And let's say this is your acupuncture needle, which you would never use something this big, right? But how Dr. Wong would show me how to stimulate this point, which is just a little bit of stimulation. Sometimes when you put it in, it instantly you feel it, that's it. This should generate some electrical out to your fingers, but also up the arm as well. And to get that gentle sensation of I don't feel anything. Well, you'd put the point in, and then you'd put your thumb on the needle with your index finger curved like this, and then rotate your index finger. Your thumb stays stable. This is a very gentle technique to activate pericardium 6. So that's just to get very detailed, which I think if you have your intention of what you're trying to do, that's a huge part of this. And then trying to get this technique, I think, will help enhance that. But I still believe intention is like 80% of acupuncture. So the next point is Zhongwan Ren 12. I love this picture because this is exactly what we're trying to do with gathering the qi. The mother holding the earth, holding the child. It's you holding your inner child, essentially what's happening. And so Zhongwan really helps that. Zhongwan is in the center of the body, so it's going to center the person. It's going to help to bring those points to center. And it is on the Ren Mai. The Ren Mai can be thought of as the mothering channel, where the governing vessel is more the fathering channel. And there is a branch that connects. We know this is the front moon of the stomach, so of course it's going to the stomach. It's helping the earth element for that E. But it's also there's a branch that goes to the small intestine channel. And the small intestine channel, as you guys remember, separates the clear from the turbid. So it helps with that clarity of thought. Because what did I talk about when one of the physical symptoms of emotional trauma? Poor concentration, foggy head. You can't think clearly. This helps to promote that. It also regulates rebellious qi, so that way we have the body going in the right direction. We're trying to get the energy back in the correct direction. With the needling of this, I will also use 34 gauge needle. And it's the midway point here, but I feel for the little space. So I encourage you guys to feel for that space on Ren 12, because it is something that Dr. Wong would also really emphasize, that you're really trying to find that opening. And that's just another aspect of that needling. The last point is Sanya and Jiao spleen 6. And I love this picture as well because it's the hands holding soil so life can sprout. And that's really, I see Sanya and Jiao spleen 6 doing this because it helps to benefit the blood. It helps to regulate the blood. So there is that form of the body, so then the body can actually grow. And there can be that processing. Now we know it's connected, it's on the tie-in channel, so it's going to connect to that earth element for the rhythm and for helping the E. But it's on the 3-in crossing, so it's also going to benefit the jur. So someone can keep to their destiny, keep to their spirit path. It also connects to the Hun, so here we go again with helping the general to make those decisions. And the thing about the Hun, you guys remember, it's about courage. It's about the ability to act and to act at the right timing. You know, there's a difference between bravery and courage. You see a burning building, someone who's not a trained firefighter is just going to run in the building to save that dog that's in the, up in the second floor. But if you look at a firefighter, they don't just charge into a building. She'll assess the whole building, look at where the exits are, where there might be a backdraft, and then enter the building and save the dog. So that's the idea. We want to improve the Jueyin so it can make those choices and make that accurate decision making and have that timing. And that is part of the whole process. You saw those pictures of people. We have more pictures, but of people processing their trauma. This helps them in that ability. Now, in terms of the location, you guys, it's like 3 tsun above the medial malleolus. This in microsystem, if you look at this as being the head and the knee being the feet, this is the heart area. So it relates to the heart. So it's going to help calm the heart, calm the spirit. The location of this, where I find it, and Dr. Wong has taught me, is it's not exactly 3 tsun above the medial malleolus. It's a little bit usually higher. You feel along the medial malleolus, along the tibia, and then you'll drop into that space. And so that's where he will find it as well. I usually use a 2 tsun needle for this. Typically, why? Because I want to go a little bit deeper to be able to go all the way to the heart, because we're going to be activating this all the way up to the heart. So that's the point combination. And, as he was asking earlier about how, is this gentle or strong or a lot of points, it's simple treatment. And a lot of people are just like, oh, I want to do other points. I want to add a bunch of other stuff. I would just say try not and just try this approach. This is another diagram drawn by Kirsten Wright that's in the book, and I really love this. It's that idea, that's your intention. I really believe intention. Richard's speaking this weekend about intention as well, and I find that to be an incredibly big part of acupuncture. You guys have probably found this too in your practice. This is why I just went on and on this big song and dance about why these points work for this. Because if you have these ideas in your head, it will help when you go to do the acupuncture and the needling and just your whole intention of what you're trying to do. It will help enhance that greatly. So this is the idea. Now, when I go to do this treatment in clinic, if somebody's had a lot of acupuncture, they're fine with it. I'll usually start pericardium 6 on the right, then pericardium 6 on the left, and then spleen 6 on the left, spleen 6 on the right, Zhang Wan, Ren 12, and then Yin Tong. That's the order. Why? Because the order of the qi goes up the right side, down the left side, like this in the circle. So it's going in this Tai Chi movement. We want to keep that movement. We want to encourage that flow. We don't want to go chaos, like point here, point there, just like randomly throughout the body. We're trying to eliminate chaos. So besides just doing a gentle treatment, we're trying to also go with that flow, go with the energy that's moving through the body, through the universe. But if somebody comes in, they're scared of acupuncture, they've never had it, they are really sensitive, I'm not going to start with pericardium 6. I usually start with down here at spleen 6 on the left and then spleen 6 on the right. Why would I do that? There's been many studies to show in pediatrics that kids are feeling most safe when you approach them from their feet. You guys probably know this. So when you go to a kid, you're not going to go right to their head. That's going to freak them out way too much. So you start with the feet. So same thing with acupuncture. I'll start with spleen 6 and then move up to pericardium 6. But if they're really sensitive and they're feeling too much, I'll even skip that point. I might just do acupressure. It's fine. Now with Ren 12, that's another important point to be thinking about because there's been a lot of people who've had abuse and trauma, and if they've had that and they're feeling worried, you might skip Ren 12. It's okay. It's not a problem. You can have that intention that you're needling it. I always ask people to lift their shirt. Are you okay? I always, every single time ask them, are you okay if I do a point on your abdomen? I'm not just going to start bringing their shirt up and doing the point. It's no, because you could trigger a trauma. So those are just some side notes to this idea, because there's a lot of levels that you're working with on this. Any questions? Yeah.
Could you just briefly say the sequence again in which you put the needles in?
So in someone who's feeling very safe to acupuncture, totally fine, pericardium 6 on the right, pericardium 6 on the left, and then spleen 6 left, spleen 6 right, and then Ren 12, and then Yin Tong. Again, but that's good. You guys can, but if you remember just the idea of the flow of the qi, then you can always just remember that, and that will just guide you. The reason why I do it in that order too, besides just trying to get that qi flowing, then I'll go to the Ren 12 to help center, and then I'll finish with this point to help with their perspective. Because usually when people go to their face, it's just a sensitive area. I just usually end with that, and also just helps to accent again that opening of the perspective. So usually so the question is, how long do I do acupuncture? Typically it's 30 to 45 minutes for everybody. Kids is less, of course. I treat many kids. I treat kids 3 months and up. So kids are 3 months in and out, like that. 4 years old, maybe for 5 minutes, potentially. 8 years old, probably like 10 minutes. And then when they get towards teens, I'll go 20 to 30. But I have a lot of kids. It's funny because I've always end up seeing more of the ages that my kids are. So right now I have teenagers. So I have a lot of teenagers coming to the clinic. One morning it was all teenagers. It's like, whoa, the onslaught of the teens. But then every once in a while a baby comes in, I'm like, whoa. I'm not ready for another baby. Nothing against babies, but I'm onto the teenage mode. Okay, so now here's an example of somebody who came in who she had recently been divorced, single mother, had been through a lot of relationships, felt really lost and sad, but what really was going on was bringing back this old memory. I mean, it was obviously still she could remember, but brought it to the surface of her mother dying when she was a young girl. And just feeling like, oh my gosh, I'm on my own again, I'm not held, I'm just, not feeling safe, and really stuck. She was really stuck. She had finished her graduate program, but she was delaying on taking her licensing exam. So she was just stuck. She wasn't moving forward, and she was just feeling very, almost hopeless. You can see on her face that her spirit just a little bit just kind of checked out. You can see a little bit of cloudiness to her skin. Her skin is just not as lively. There's not that enlivening of the spirit. So I did the treatment for gathering the chi on her, and she got much better. She started feeling like, and this was just like after a week or two, I forgot the timing, but it was about a week or so, 2 treatments, and she felt that more safe, held. Again, that was the whole idea, especially for her, that mothering, helping her to feel mother, to feel safe. And so her spirit came back, her spirit's lighter in her eyes. But we'll see where she went even after this to the next stage of treatments. But she already had made a change. You can see that more shed, especially in the skin, I can see that the most. Now, besides, here's the big drumming part. You guys ready for this? This is like the play we've all been waiting for, right? Some kind of crazy drumming happening at an acupuncture seminar. I do a lot of drumming in my clinic. I am a drummer, and for the longest time, I had 2 different worlds. I play in a wild rock and roll band, which you might not imagine from the way I look, but I do. And then I do Chinese medicine. So it's the yin and yang, but I was very disparate. They were not coming together. So I work with this drum teacher who does a lot of drum healing, Toby Christensen, and he was teaching me these different shamanic beats that relate to a tribe in West Africa, and showed me the medicine wheel, and it is identical to Chinese medicine. Identical directions, identical numerology, identical colors, identical spirit ideas. The only thing that's different is the fingers. You know, this is the fire finger in Chinese medicine. In the Dogara tribe in West Africa, this is the water finger. But besides that, it was pretty much identical. So I was like, wow, this is interesting. So I've been working with these beats and also doing shamanic drumming. And what I'll do is I'll put the points in somebody, and then I'll do the drumming over their body. And the needles act like little antenna. They bring in that resonation. They help to open up the channels. This is the same thing if you do singing or chanting or singing bowls or tuning forks. I love resonation therapy. Speaking is resonation therapy. What you tell your patients, how you talk to your patients, that's resonating with them. That's resonating their tissues. Sometimes it's more important than anything that you're literally doing is your resonation with that person. So the drum is great. I love it. And so what I would like us all to do right now is I want you guys to experience the drum from afar. I'll be doing it up here. But I would like you guys to sit in your chair in more of a qigong stance. So have your feet both firmly planted on the floor with your feet pointing forward. I would encourage you to sit forward in your chair so your back is not against the back of the chair. It's forward. You can have your hands either on your lap or on your lower dantian. For women, if you have your hands on your lower dantian, I would encourage you the right hand and then the left hand on top. For men, it's your left hand on your lower dantian and then your right hand on top. Lower dantian, you guys all know it's right below your belly button, right below the umbilicus here. Your mouth is closed, your teeth are touching gently, your tongue is touching the upper tooth ridge. Your back is straight, you're lifting your body up. You imagine being that string on Du 20 Bai Hui, bringing your body upward. So your body's upright, your head is upright. Your eyelids can be very relaxed, almost closed. You can make out the tip of your nose tip. So your feet are firmly planted on the floor. Your back is straight, your head is upright. And we're going to imagine breathing in that yellow color, healing-like sunlight that's surrounding our body, breathing that in with all the pores of our body, with your lungs, breathing that energy in. As you breathe out, imagine it gathering in your lower dantian. It's condensing in your lower dantian. So breathing in that yellow, like healing sunlight energy. And then breathing out, gathering your lower dantian. Taking your eyesight within, listening within. This Sapasha was taught to me by Master Zhongshan Wu. And I find it very helpful to get you centered and get you settled and to be able to receive this sound resonance. So I just encourage you just to take your eyesight within, listen within, and see what you're feeling with the drum. Where do you feel it in your body? What are you feeling? listening within. I typically do this and then let the patient rest for 30 minutes and then do one more drum beat. So just keep your eyesight within and just listening. How is this resonating in your body? Still breathing, yellow sunlight energy in through pores. If you breathe out, it condenses your lower dantian. And you can gently open your eyes. Just coming back here. So this is something that I do for people not only with emotional trauma, but for all kinds of conditions. And I find that drum beat, you can see how you feel it. I can talk all day long what drumming does, but it's until you feel it. Just like anything, you have to experience it. But the way I look at it, it's helping you connect with Mother Earth and Father Sky. And that steady drum beats doing that is helping to put you back into rhythm. We talked about that idea of rhythm. And also, what's the first sound you hear? The heartbeat of your mother. And then your own heartbeat. So we're taking you back to that womb-like state where you're safe and held and secure. And bringing you back there. So you can get back in touch with that sense of security. Then at the end of that, I will do that 7 drum beat 3 times. That's to harmonize yin and yang and the 5 elements. So that's also to help ground and just complete the treatment. You guys also heard in the middle of that, I did a different rhythm. That's the metal rhythm. That's the rhythm that relates to the lungs, large intestine, helps me to let go of old trauma. I don't do that on everybody. I did it today because why? We're in the metal time. We're in the yin metal time. So it's a big time for the lung to become congested right now. A lot of people are needing to let go of old energy. They're also getting stuck and the energy isn't moving in the lungs, it's not descending. So that Tai Chi is not happening. The lungs are supposed to be descending, the liver is supposed to be ascending. People get stressed out in the fall. The liver doesn't ascend and the lungs can't descend. Or vice versa, the lungs get congested, the liver can't ascend, you get this stressed out. A lot of people get cold, so I'll sometimes use that beat to help benefit their lungs, deal with grief, and also deal with letting go. So like I said earlier, for those of you, and some of you have already jumped the gun on this and already got the download cards, for those of you, the first 30 people who buy my book from Singing Dragon Booth today will get a free download card of the CD that I recorded that has all these drum beats. And so there's drum beats for each organ system. And I'll use that for different conditions. Say somebody has a cough or asthma, I can do the metal drum beat for them, that's fine. And so this really, in this context, for helping to gather chi, helps to bring their spirit back into their body, reestablish that rhythm, help to build that earth energy. Now, another thing that I use are herbs, and for you herbalists out there, there are several herbal formulas you can use, but one I find very effective is a modification of Ganmai Dadzao Tong. This was taught to me by the head of the psychiatric department in the Beijing hospital back in 2001, and I don't have his name. I've been trying to find his name, but I couldn't get it. I apologize, but he was a doctor that Dr. Wong really highly regarded and had us study with, and he found this formula very effective, both, of course, the guy who taught me this formula, but also Dr. Wong, to help deal with trauma, to deal with depression, to deal with when someone's really stuck. This is not a one-size-fits-all. This is not for everybody who has emotional trauma, so please, this would have to be differentiated. It's not for everyone. But I use it quite a bit. We know Ganmai Dadzao Tong is typically for helping to deal with that nervous energy in the body. And so it's a great base formula, but the way that this guy modified it, I find is incredibly effective. And so what he adds is some simple ingredients, but they're very powerful. Bai He, lily bulb. That's to tonify the chi. A little bit cooling, helps to benefit the heart. It goes to the heart and to the lungs. So again, we're helping to work with that heart energy. Longu and Hupo, dragon bone and amber. These are very sedating, bringing the spirit back into the body. And they work very well in that regard. And then the last, Guya, you could use this or Gung Mi to help with digesting the mineral herbs. So this formula, like I said, is a good base formula, and then you can modify it for the constitution. And what I find this helpful for is with that, when they're feeling very scattered and they're feeling that triggering, this helps them to get settled. I have them take this usually for maybe 1 to 3 weeks and then start to taper off and then take it as needed if they get charged again. But this is just a base, and this is something that you would need to modify, of course, but it is at least gives you a direction of how we can gather the chi with herbs. And this is a pretty general formula for the most part. Those mineral herbs, you want to make sure the patient's constitution can handle it with their digestion. But usually I give a pretty high dose of Guya. It can be up to 20 grams. Sometimes if the patient has a very strong digestive system, I will increase the Longu and Hupo to maybe 9 grams. So another thing that I use are, and this is all, by the way, these should be loaded in the portal, are affirmations. Affirmations, as you guys who use them realize how powerful they are. We tell ourselves stories every single moment. And if we can make those stories more positive, it can change things dramatically. So just simply as saying, I love and accept myself. I am safe. I am present, feeling safe in my body. I'm calm and grounded. All these very seemingly basic phrases can really help someone get more grounded and more gathered. And I have people do these 200 times a day. They can do them when they're, walking to work, when they go to a red light, whenever. And I also encourage them to do it 25 times in the mirror. That's incredibly powerful. So you guys can try that and just see how, if you haven't done this before, I would encourage that. Now, besides affirmations, I do a lot of work with lifestyle. I'm kind of known as the homework guy. I love to give a lot of homework because I want people to have something they can do in between treatment. I usually see people once a week, that's it, at the most. And then I usually, after maybe 3 or 4 weeks, I start to go to every other week, 3 weeks out. So I want to build them a tool, want to help them get a toolbox that they can go to, especially with the traumas triggered. Affirmations. What else? We want to help establish the rhythm. So basic things like making sure they get more rhythmic with their lifestyle. Regular waking times, regular sleeping times, regular meal times, making sure they get their protein every meal. This stuff might seem, it seems so basic, but believe me, there's so many people who are not in that rhythmic motion, and it can make a gigantic difference for them and really help get them back into that movement. So this is a lot of what I'll use for gathering the chi. Now we're going to move to the next stage, which is called soothing the trauma memory. This is now fathering the body, fathering the patient so they feel like they can move forward. They have that encouragement, that confidence to go forward out into life. So with these points, your intention is bringing down the cosmic water of the universe. Now, what the heck does that mean? I don't know if you guys have heard that term before, but we have the Father Sky energy bringing down cosmic chi. We have that always coming down from us, coming down to us. Along with that is this cosmic water of the universe that's descending. And there are points that I've been taught by my teacher, Susan Johnson, who was taught by her teacher, Shui Jian Lin, for working with PTSD and working with these ideas of soothing that trauma memory. We're helping to reduce that charge. Like I mentioned before, it's charging the body. You're getting that heat, the wind. We want to soothe it. So remember going back to that brain triad, we have the prefrontal cortex, the limbic system, and the brain stem. That limbic system is firing off. You got that memory. You're remembering when that truck hit you, 20 years ago, that red truck pulled out. Now you're starting to see cars coming out where they're not there. This is a real case I had. I had a woman who was hit. She was driving down the street. A car pulled out and hit her. She was a very aggressive driver. It was not her fault, but she was a very aggressive driver. After that, she drove very, very, very calm. Her kids couldn't even drive with her anymore. And then she eventually couldn't drive because she kept seeing these cars come out. Well, through working with gathering her energy and then working with this triggering of this emotional trauma and this memory, she's now back on the road and she's back to being an aggressive driver. Well, I don't know if that part's awesome, but she at least has that confidence to go back out there. So we're helping to work with that charged memory that's triggering the limbic system and benefiting that prefrontal cortex. So it says, wait, time out. No, this is not back in the time you were 20 years ago or 10 years ago, whatever it is, and to settle that down. So then it doesn't send signals to the brainstem to then flood the body with these chemicals saying, oh my gosh, we're fight or flight. So that's what these points do. Now these points are on the scalp, and there are 4 points. And we're going to go through each one and what they're about. But there's Du 20, Bai Hui, governing vessel 20, the top of the head. Governing vessel 24, Shen Ting, and that's 0.5 soon within the hairline. For those of you who still have a hairline, mine's fading fast. But so Shen Ting, and then there's these points, Sure, that are lateral to Du 24, that are between the gallbladder and urinary bladder channels, and I'll talk about those in a second. But these are the general points for soothing trauma memory, and then I'll add a couple body points to this combination. So I might add a few of the gathering chi points. I might add more extraordinary channel points, bigger ticket points, so to speak, that are going to get to a bigger aspect of the body. Maybe something like stomach 36. Depends. Depends on what's going on. But the point is I will use these as the primary aspect of soothing trauma memory and then support that some way with the body based on their constitution and also based on the universal energy flow. So the first point, Du 20, Bai Hui, top of the head. This point has the ability to nourish the brain, nourish the marrow. So again, there we go. We're helping to benefit the brain, benefit that connection with the prefrontal cortex, but in a bigger way, benefit the marrow. That's that nourishing aspect, bringing that cosmic water down. It's also the opening to the heavenly energy, so it's helping to facilitate your heavenly energy getting into the body, helping to bring the spirit back into the body. We were talking about possession earlier, and that idea of the spirit leaving the body. Now you have an empty vessel. You have an open house for some spirit to come in. Now Lillian Bridges talks about where you can get the most likely chances to get a spirit to come in your body. Empty bars, empty churches. Kind of interesting, right? Graveyards too. But the point is the vessel's empty, so we got to get the spirit back in the body. This will help to bring it back into the body and root it. Now, it also has an internal connection to the heart. So again, we're helping to still the heart, calm the heart down. And it connects to the mud ball palace, like the form of the spirit to help benefit the spirit. And it also goes to all the yang channels. Why would that be helpful? Because the yang channels, if they're all disordered, this helps to again settle and order those channels. Du 20 is used a lot for pain, general pain in the body, and that's one reason why, because it can soothe all the channels. So it's working on that level too. Now, in terms of needling this point, for scalp points, I use Chinese needles. I don't use Japanese needles. I found that the round edge of the Chinese needle is easier to go through and thread in the scalp than the Japanese. The Japanese is more likely to pierce deep in the layers and cause a lot of discomfort. So I use usually 2 Tsun Chinese needles that are typically 32 gauge. And what I'll do is I'll go underneath the skin, under the first couple layers, and then thread it. Okay, underneath the skin. You guys probably do a lot of scalp needling, but I'm just going to tell you how I've been taught. And I thread it usually an inch and like a Tsun and a half in, Tsun to a Tsun and a half in underneath that layer. Then to stimulate the point, I've been taught not to do lifting and thrusting on the scalp. So you're not doing this kind of action. What you're doing is you're putting it in, at least the way I've been taught, putting it in, holding it firmly with one hand, and then it's just right underneath the skin, and then rubbing the skin over the needle this way. Now this is a very gentle technique. It's gentle style. So you're not doing really super vigorous. It depends, but pretty gentle. What you're trying to do is create that static energy. You guys know, like when you have static energy on your clothes, you rub your hand and touch your friend and shock them. It's that idea you're creating that energy field underneath the needle. right over the needle here. And so you're doing that on all these points. Now I'm exaggerating the movement again, but it's gentle stimulation that way. The next point is Shen Ting, do 24. This is a very great point to calm the spirit, benefit the brain. It's right in that frontal area, so it's going to help to benefit the prefrontal cortex. Both do 24 and do 20 were used in studies in China where they did brain imagery before and after doing these points. They found the prefrontal cortex light up and become engaged, improve that communication to the brain. Very important, right? What we just talked about, the trauma memory being triggering that, and then the prefrontal cortex shutting down. We want to get that activated again, so it's working well. This also connects to the mud ball, to that spirit element. It connects to the bladder and to the stomach channels. Now, the bladder channel, why would that be important? Because the bladder channel goes to all the shu points, so it can connect to all the spirits. It helps to regulate the jur, the hun, the shen, the yi, and the po. It regulates all those spirits, so it can help with that. Somebody had a question on the break about possession and night terrors. I don't know if anybody of you treat night terrors, but I have treated that pretty successfully from a point combination that Dr. Wong taught me. It's basically doing acupressure on the outer shu points. So before they go to bed, you can do acupressure on the outer shu points. It works really well, at least in my experience. It's something you guys might try. But that's, again, working with that idea of spirits and working with the spirits that the bladder channel connects to. Stomach channel is important because it's working with that earth element, so it's helping to benefit the earth. This point also pacifies wind. We talked about that idea of yang and wind rising. Just like do 24 does, it helps to pacify and calm that energy that's rising up to settle that down. Good question. So the question is for threading for this point, front or back. This point you thread forward. Now this point, when you thread it, you'll see the needle right under the skin. You'll actually see it. When I first started doing this, I'll admit, I had a couple times I came out of the skin. That was not so awesome. The patient couldn't tell, but I was like, oh my gosh. So you have to do this gently, of course, but as you go through, you're getting it under those layers, and then it's hard to show this. I usually demonstrate this in longer lectures, but there's a way you can bend the needle, so to speak, so the needle would be curved up a little bit. That helps to guide the needle down. So you're kind of bending the tip to then help it guide underneath the scalp and then thread forward. But it's something I would encourage you guys to try. It's very important that you guys try to thread this. It's a really important aspect to encourage that intention of bringing down that cosmic water. So when you thread this, your intention is bringing that cosmic water down. So this point's going forward, just like the points lateral to it will also go forward. So the front ones go forward, the do 20 is going back. Now these points, they're Osher points. They're between the gallbladder and urinary bladder channels here. And so they're in here, and you guys could try to feel on your scalp. There's a little groove and indention there that you can feel on your scalp, and it actually curves a little bit towards yin tong, towards that third eye area. So when I needle these, I am needling at an angle going towards yin tong gently, not at a real harsh angle, but at more of a gentle angle. I am not going straight down. I am angling it in along with that groove. So the best way is just to feel that notch and that indentation there. But this point is like 1.5 tutsun lateral to do 24. Now to talk about these points, why would they be helpful? Well, they're between urinary bladder 4, chu cha, and gallbladder 15, tolin chi. And let's look at each one of those points and why they might be helpful in relating to these Osher points. Urinary bladder 4 treats agitation of the heart and heat. So this is exactly what happens when there's a trauma memory. There's agitation, there's that wind agitating that still heart mirror, and then there's also the wind coming up, and there's the heat coming up. So there's that agitation, that heat rising. And then I just talked about the bladder channel connecting with all the organs, so there's that aspect. Then gallbladder 15, this connects with the yang wei channel. So like the yin wei channel, the yang wei has the ability to nourish. So there's that idea of cosmic water coming down. Now, the gallbladder channel, why would that be interesting for emotional trauma? We know the gallbladder channel is the pivot, it's the xiao yang. So it's between the outside and inside. And this trauma is like that. It's trapped in the body between the outer and inner layers because it's coming up, surfacing, going back down. Coming up, surfacing, going back down. Coming up. And so by working with the Xiaoyang channel, that can also help to clear that pathogen that's cycling. Just like that woman I said in the first half of the morning who was getting cycling every time her sister's anniversary of her death came up, she would get incredibly traumatized. These are cycles again, these cycles in the body. So these points we're angling towards yin tong and working with that. So again, we're working with that PTSD, we're working with that emotional trauma memory that's coming up. We're working with the, on the Western medical side, working with the brain. And we're helping to soften that charged reaction. But what's interesting is when you're doing these treatments, we finish gathering the chi. Well, wait, when's the magic time we finish gathering the chi and move to soothing trauma memory? How does that work? Well, it's based on what you're feeling with the patient, what you're seeing with their spirit. Typically, 1 to 3 treatments of gathering the chi is enough to get somebody settled in their body and you can move forward to soothing trauma memory. Again, these are the bigger picture items. Then we can start differentiating. But sometimes somebody has a strong charge of that memory. It's so intense we have to go back to gathering the chi. I have an example later of this woman who that happened to, and we had to go back to gathering chi and start again with centering her because the trauma was so intense. So just to iterate it one more time, the intention of bringing that cosmic water, bringing that Father Sky energy down, working with the governing vessel, the Du channel, which is the yang channel of the body, the fathering channel, if you will, of the body, really accenting the idea of giving that person the courage, the encouragement to move forward. Okay, so those are those aspects of the treatment. So here is an example of a patient who, I talked about her earlier about the charge. I showed her in the morning with the diagnosis earlier in the morning, who had the heat, that wobbly chin, the redness in her chin, the fear, kind of the checked out look in her eyes. This woman had come to me probably a couple years before this picture was taken to be treatment for trigeminal neuralgia, had incredible strong face pain, and so severe that she was taking high doses of Tagamet. She was having pain daily. She couldn't eat solid food. She was completely exhausted. The medicine made her very foggy-headed and just out of it. And her doctor had said, you can't take any more medication. Your body energy is fading. You should look into a nursing home. Well, this patient said, no way. I'm not doing that. I'm not going to go to a nursing home. I'm going to find another way. So she came for acupuncture. Through treatments, she was able to take less medication. She became pain-free. She had able to eat solid food. And I really credit my teachers, Dr. Wong and Dr. Young, for the treatments they taught me to work with trigeminal neuralgia. And it was great. She was doing fine. Well, just like all patients, when they're doing better, guess what happens? They don't come back. They're done. That's it. So she was finished with treatment. I was like, fine, you might come back in a month or so, but she got busy, whatever. And she was living in this huge house, like doing her own thing, doing all this stuff, traveling around. I mean, she was doing great. Then one morning she woke up, had breakfast, a flash of pain. Just a momentary flash of pain. It brought it all back. It was just for a moment she felt the pain, but she went all the way back to when she was on those heavy doses of medication, very fatigued, pain daily. You know, her life was fading. So she was very scared when she came. And I took this right before we did treatment. Then, in her case, I didn't feel she was so scattered as her memory was so charged. So I did a little bit of work with centering her through Zhang 1 and Spleen 6, but I also added a point, so I did the soothing and trauma memory protocol on the scalp. Now her face pain tended to be between her eye and her jaw. If the face pain would have been up in her forehead, I would not have done those scalp points. I don't do local needling if somebody has facial pain, just an FYI. But in this case, it was okay because it was above where the pain level was, or above where the pain was. I also did a point. Her pain was on the left side. You guys could probably even see that when you see her face. So I did a point combination on the right side, which is stomach 36, and then about 2 tune below stomach 36, a little bit lateral. These are points that Dr. Wong and both Dr. Young use for treating trigeminal neuralgia and facial pain. Anyway, just an aside. But the point is, I did this combination and then took a picture right after treatment. And you could see how she improved. Her skin color softened. It's not as red. Her eyes, can you guys see that spirit change in her eyes? This, again, is just 30 minutes, so it's not like those before, those 6 months. You know, this is right after, but she felt that lifting. She reported that she didn't feel that same charge. She felt relaxed. She wasn't feeling scared. Her chin got less red, so there's less heat in the chin. And just her whole body is just more peaceful. You guys can see that her spirit is coming back into her body. So that's an example. Here's another example of that woman I showed earlier who had gone through that recent divorce and was remembering about her mother not being there when she was younger and how she felt so alone, and did the treatment for gathering the chi and she felt better. But she was still being taunted by that memory and not feeling like she could move forward. This is one I was telling you guys about earlier, who she had finished her graduate program, but she hadn't taken her licensing exams. Like, take your licensing exam. You're going to pass. Like, oh, I won't make it. I won't be able to do it. There was that idea of not being able to move forward, feeling stuck, not having that encouragement. So I was like, okay, now you're centered enough. She was processing. She could start processing some trauma and really recognize how this, traumas in the past had limited her now in her present time. So now it's time to soothe the trauma memory, get her so she can move forward. So I did the soothing trauma memory points, and then I started working constitutionally. In her case, there's heat. You can see the redness. There's also oiliness. So there's some dampness. So the tie-in channel is affected, working with the earth element. We're also working a bit with her kidneys, too, because she had a lot of issues with fear. So after I did the soothing trauma memory, I started working with those specific channels. And then she felt a lot better. She was able to apply for her licensing exam. She took her licensing exam. Of course, you guys could guess. She passed her licensing exam, and she felt a lot better. So you guys can see that change, that shift. I see it primarily in just her spirit animating her whole facial structure. Here, there's just this kind of like heavy, set feeling where she's just not moving forward. And then she starts to lighten, and you can see her eyes lighten. Spirit started coming back in her face. And just that hopefulness. I mean, I don't know if you guys can see that kind of sense of hope there, that sense of like able to move forward. And what was so cool is she passed her license exam, and then she was able to apply for a job, and she got a job as a administrator at a health facility, and was working in her field and felt great. A few weeks after this, she also had to make a trip with her son to travel on an airplane, which she was deathly afraid of. But we continued working with showing up that strength, and she flew successfully and felt really good, and just had that power. So this is, again, that kind of progression thing. This happened in a month, so it happened pretty quickly for her, this transformation. Things everybody's different. They're not going to all respond the same. But you're going to see, hopefully, some shift. And if you're not seeing that change, you might want to change your approach to treatment. But look at the eyes, look at the skin, and feel the channels and feel the pulse. Once you've got this memory soothed, then we're going to move on to the next level of working with the differential diagnosis, looking at those symptoms, the patterns, how do we differentiate what's going on for that individual. Now, in this morning, I don't have time to go through all of those differentiations. In my book, which for those of you who didn't hear earlier, I will be signing at the Singing Dragon table at the end of this lecture, bless you. And I still have some download cards available for the drum beats. Okay, so in this book, I talk about, going through anger, all the differentiation of anger, all the things you're going to see on the face for each differentiation, all the things you're going to feel in the pulse, all the things you're going to feel in the channels, all the things you're going to see on the tongue, all the things you're going to feel intuitively. That's all differentiated for each, main emotion, and then all the differentiation within that. Also the different physical symptoms, insomnia, feeling that low energy, body pain, mood swings. And not only that, there's also the behavioral issues like the cutting, the self-harm, this kind of things, avoidance, but also sensory issues. I talked to you about that woman who's driving down the street and she started seeing cars come out. How do we work with the sensory issues when people are literally being triggered where they're hallucinating or they're hearing things? How do we work with that? So I can't get into all those differentiations, but I would like to talk about a few key points here that I think are just helpful to talk about and to mention. So the first point is Leo Chue, which is lung 7. It's a low collateral point on the lung. It's a command point of the REN, the conception vessel. This point's very helpful for mothering. You know, you get to the stage where someone's feeling pretty settled, they're feeling gathered, their memory is soothed, but they're still having issues with that mothering, not feeling held and secure. You can bring lung 7 into the mix. For this point, it is on the lung channel. It's not found off the channel. So Dr. Wong and Dr. Young all find it on the lung channel. So this point is in the space by the vessel. It's not like over here or whatever, or they show it in the textbooks. Another point that's helpful is gallbladder 41, Zulin Chi, and this is a command point of the the belt channel. It's also a shoestring point. This point is very helpful for patients who've experienced sexual abuse and trauma. Why? Because the channel, the belt channel, can become congested in that situation. And it's not just for sexual abuse conditions, it can also be for when someone has taken a trauma that they don't want to deal with and they push it away. They shove it down and it gets trapped in the belt channel. I've seen this a lot too. So people will sometimes complain of, oh, when I feel that trauma, I hit back pain or I get hip pain, and this can come up. So this can help release that. Again, I wouldn't start with these points. I would still do points for gathering the chi before I moved on to these more details. Another point that can work with sexual trauma is Gong Sun, spleen 4, the opening point, the command point of the Chong vessel. It's also a low collateral point. This point can work with very deep issues, very deep stored traumas, stored in the blood. This also works very well with inherited trauma. You guys were asking about that earlier. Inherited trauma, this is something you can work with because the blood, besides the kidneys passing down that Jing energy with the inherited trauma, it can also be through the blood. You guys have heard of fetal fright syndrome, when a mother has, during pregnancy, experiences a shock or trauma, that can go to the child. There was a question about that earlier in utero. And that is, they found through the hormones go through the blood to the child, and that's where they get stored. They've done studies with children after whose mom had that fetal fright, where they can still find those chemicals in the blood. So it's also passed through the Chong Mai. So you can use the Chong Mai. But the big but on this is you can't start with spleen 4. You do not begin with that point. You have to work your way towards that. So I usually, and Yvonne Farrell in her book on the 8 Extraordinary Vessels talks about this as well. Starting with the belt channel, opening that channel, and then when that's been cleared and open, then you can start with spleen 4, Gong Sun. And typically, sometimes I'll even pair lung 7 and gallbladder 41 together to help that person feel safe and settled as they process that trauma. Because what's going to happen? Old trauma is going to come up. And we want to make sure they're feeling in that safe space. And that's very crucial. So I do a lot of work with affirmations for that. Also flower essences too, to help them stay held. Yes?
When you're actually unlocking someplace, I've read other stuff and experienced other stuff where it's very helpful to be working with other therapists.
Correct.
So it's like you're unlocking a box. It's good to have maybe some sort of talking therapist in the weeds.
Right.
Or even working with you directly.
Yeah. I 100% agree, and that's a perfect segue for these next points. Because the idea is in Chinese medicine, we're working somatically. We're helping the body to transform and work through those old memories that are trapped in the tissues. But we're not therapists. Of course, I talk to my patients, what emotions are you feeling? What's the level of intensity, this kind of thing. But we don't have that skill set or that time to go through and talk with them about what they're processing. So yes, I always recommend people see a therapist, a counselor, psychologist, psychiatrist, licensed clinical social worker, whatever, someone to be able to process and talk about with. But that begs the question, what about those people that can't talk about their trauma? They can't express it. What can we do in that case? We can work with river points. Okay, so river points, as you guys might remember, river points help with any disease associated with sound. Coughing, wheeze, hiccup. Guess what? It's also the ability to express yourself and talk about the emotional trauma. So I will use different river points. I just use this point combination as an example You could use I used all river points, but and I use river points a lot. I love river points actually. But Kidney 7 Folio and UB60 Kunlun, these are great points to help with expression issues dealing with fear. So scared they can't speak. You've probably experienced this with patients you've worked with in the clinic. They've had so much fear they literally can't even talk about the trauma. Now, we're not trying to have them express at length about their trauma, but to be able to express themselves is crucial. And so river points are amazing for that. Now, this would be more around fear. Why? Because these are relating to the water element, and water is associated a lot with fear. Let's say somebody had anger. They were so mad they couldn't talk. You might think about gallbladder 37, the low point of the gallbladder channel, the Xiaoyang channel, to then open up the Xiaoyang. One last point I want to talk about is Shenmai UB62. This is the command point of the Yang mobility vessel. This point is helpful. We know that the Yang Chow is helpful to innervate all the Yang channels of the leg to help if somebody feels like weakness or numbness or they aren't able to move their leg. You can use this point to bring that energy back. But energetically, it helps somebody move forward on their path. So like with that trauma memory, it's stopping them and it's taking them back in time. This is a point you can use a lot of times to help them propel forward. And I've used this a lot for patients in the clinic. So in terms of point selection, I always use stems and branches technique. This diagram comes from a book written by Master Wu. It's Tin Gan Di Zhi, that's about the stems and branches and how you can look at the energy flowing through the universe. We want to stay in harmony with the universe. For you gardeners out there, are we going to plant a tomato in January? No. Why? Because the chi is not available for it then. Same thing with points on the body. There's different channels and organs that are more open and more active by the time of the year. Now, of course, you can apply this throughout a day, but I found it's very impractical because you have to have somebody come in at 3 in the morning or something. In this case, I'm looking at the stems and branches by each month through the 12-month cycle. I don't have time to get into detail on this, but it is in the book, and I feel very grateful to Master Wu for teaching me this. I've been interested in stems and branches my whole career, but it wasn't until I understood this way, this shamanic way of looking at the stems and branches, could I really apply it. The stem will tell you what organ is open. We're going to talk about, right, in this context, I'm talking by each month right now. We'll tell you roughly in the 30-day cycle what organ is open. The branch will tell you what the weather pattern is, what organ is open, and also what channel is open. That's usually based on the 2-hour clock cycle. If you superimpose a clock over the 12 months, it's where that falls. So for example, to apply this, we're here in September. The heavenly stem is yin metal. It's sheen, and that relates to the lung. So the lung organ is very active right now. We already know that because we're in the fall time of year. So I think about the lung issues. A lot of people come in with respiratory issues and grief, and the old grief is coming up. So it's something to be thinking about. Then I think about the branch, which is Yo Rooster, which relates to the weather pattern of Yang Ming, that's dryness. So this is a very dry time of year. The leaves are getting dry, they're falling off the trees. There's that letting go energetically in the universe. I was thinking about the stomach and large intestine channels. The organ is lung, because that branch relates the same as the stem. And then the channel is the kidney. It's 5 to 7 p.m. If you looked at the clock, we're getting later in the day right now. We're at 5 to 7 p.m. So I think about the kidney channel. So when I'm doing my treatments for this month, I'm actually thinking about those 4 channels. Primarily, honestly, and I'll find that people will come in and those channels will be effective. It's uncanny what happens in the clinic. So this is an idea for you guys to consider, to think about, and I find this very powerful. And then what I'll do is, of course, this is the overall seasonal flow that we're all influenced by right now. But we're all individuals. So it's how are we being influenced by that weather pattern right now? How I determine that? You can use Badza. You can look at somebody's birth chart. But what I do is I look through face reading, through pulse diagnosis, through channel palpation to understand their constitution, what their constitution is, where they're going, where are they at with their in their process. So that's an aside I just wanted to show you guys. Now, for the last few minutes here, I'd like to show a few cases. And this is the man whose wife had recently passed away. He was feeling very scattered, very lost. Did points to gather his chi, also benefit his lungs. You guys can see this nose, very red, a lot of inflammation. Did treatments, he felt a lot better. He started getting more in his energy. His face isn't falling so much, his eyes are getting clear, his skin is getting clearer, his spirit is coming back. Still has lung stuff, so started working with soothing trauma memory and also working with clearing his lungs. And for those herbalists out there in the beginning, I used a modification of Jirso-san, modified with Hua Shi and Tao Ren, and then I moved into Sheng Mai San. And then continued with treatments, and he felt a lot better. You guys can see that transformation. He was improved, he felt more in his body, his spirit had come back. And interestingly enough, just a few treatments after this, he started dating again, and he was seeing 3 different women, and one of them was 17 years younger than him. And he was getting his motorcycle out. I mean, this guy was going for it. Like, it's pretty amazing. So really, again, helping to bring, so again, we're doing this process of helping someone first get gathered, feeling settled, then be able to start not being triggered by that memory, and then move forward and work with their individual imbalances. This is the gentleman I showed at the very beginning of the lecture who'd done a lot of work with CPTSD, complex PTSD, and had done a lot, improved quite a bit, but was still having issues with communication, having issues with feeling stuck, not able to be engaged. Did gathering the chi, and also started working with soothing the trauma memory. And he started feeling better. He started feeling more in his body, but he's processing. He's really deeply processing those old traumas. And what's so cool about this guy is he is a musician, and he's a songwriter. And he had written a song a long time ago about transforming emotional trauma, actually, years ago. But he forgot about it. Well, doing these treatments had stilled him enough to then, I remember that. And now he's actually in the process of finishing the song and recording it, which I can't wait to have. It'd be so cool to be able to play it here at a lecture. But anyways, he started getting better. But he was feeling a lot of that trapped energy in his belt channel. He's someone who had a lot of abuse in the past. So worked with Gallbladder 41, worked with that belt channel, and then started working with the Chong channel, but slowly working layer towards layer with that. And then he started feeling a lot better. And now he's feeling much more in his body. You can see the clarity in his eyes. You can see that lift in his body and his facial structure. And looks to me, he looks younger. He looks younger. Now his eyes, there's a little bit of darkness around his eyes. This relates to the kidney area. But in facial diagnosis, water people have a little bit of dark shade to their eye. He is inherently, in his phases, in his constitution, he's wood and water. But his wood energy is so charged and so intense with reliving these trauma memories, it's been exhausting his water. Now through stilling and calming and grounding his energy, he's able to move more into that true water nature of feeling settled and held. And he's even on the table, this was unbelievable. He dreamt that he was being swept in water and being in this turbulent water, and then he came to this still place and felt relaxed. It was amazing. So this is another transformation. Here's a quick case of that woman I shared with in the beginning, who had had the emotional trauma triggering of her father passing away when she was a young girl. And so for her, we're seeing things on her face. I'm not going to get too in detail with this, but there's a lot we can see in terms of grief, in terms of the fear with the chin, even some redness on the nose as well. So we can see different emotions going on. And with channel palpation, I did find nodules at pericardium 6. And I did find this kind of thin choppiness, this disordered energy in the pulses, and a thinness. So I worked with scattering the scattered chi, gathering her chi, and then soothing the trauma memory. And she started feeling better, increased clarity, less pain in the back, working with the belt channel eventually too for her. And you can see that Shen coming back. She was less worried about the future. And then working with facilitating the trauma memory, soothing that, and working with a few local points in the Xiaoyang channel. And then she started feeling much better. So with her, you can see that her chin improved. Her face was lighter. It got rounder. She got more settled and grounded in her body's energy, and she's feeling less triggered and less activated by. Great question, and that's when I've worked through different people. They've had acute traumas, like that woman who got hit by the car. She came in right after she got hit by a car, and she had a lot of blood stagnation. She had a lot of physical trauma and that emotional trauma too. But I did the gathering chi, and it was fine. In fact, her symptoms improved. So if somebody has an external wind invasion, and you do these treatments. Now, if somebody has an acute cold, that might be a little different story. But in terms of that external wind invasion of a pathogen, it'll help shore up that energy in the body, and it will treat those individual symptoms. It's amazing. Like, I've seen this happen, and I would encourage you guys to try this. I always differentiate. So yes, when somebody comes in, I'm just like, oh, you had emotional trauma, let's start doing these points. I will still check their pulse, I look at their tongue, feel their channels, and get an overall diagnosis.
So the chi isn't scattered when they come. Let's say for whatever reason that chi isn't scattered, you
Right.
just skip that step.
Exactly. So it's questions like, if somebody's chi isn't scattered, they come in, you can use those diagnostics I talked about in the beginning of looking at the face, looking at the tongue, blah, blah, blah. And these are things you can do to differentiate. Is that scattered? If it's not, like that woman with the trigeminal neuralgia, I went right to soothing the trauma memory treatment. Yes, so you first asked. Typically, yes, right. Right. Yeah. Oh, for her protocol, yeah. Soothing the trauma. Yeah, first was gathering the chi. And then the second was I started incorporating some of the soothing trauma memory because she did feel better. She said, and what was it? I meant to mention, thank you for mentioning that. She said that she had that aha moment of, oh my gosh, because my father had passed away, I didn't have that feeling to be able to go out in the world. I never felt safe to go out in the world. I never felt like I had that encouragement. So she came to that place herself, and because she was already starting to process that trauma, I could tell that she was feeling pretty safe. She was feeling pretty secure. So I could move to the next stage pretty quickly, actually. But it's all, I mean, it's all how you resonate with the person. I mean, it might just be one time gathering the chi, but then it might be a couple weeks of gathering the chi, based on how strong has their spirit been scattered. How possessed are they? How much has their spirit left their body, so to speak? Does that help? Yeah. Do you have a question?
Very brief.
Okay. Okay.
Very brief. Pericardium 6.
Mm-hmm.
Clearly, you made your work with the sensation of up and down and down.
Right.
And spleen 6, etc., etc. But what are your thinking about Western neural pathways and that sensation? Are you just saying this is not the Western neural pathway?
No, it's not. Absolutely not. Yeah. I think this is the fascial pathway. My question about pericardium 6, that sensation of traveling. Am I needling like the radial nerve or something? I'm not needling a nerve. I'm definitely needling that interstitial space. It's the interstitial pathway. And the reason why we know that is because it goes in both directions. Nerves can only go in one direction. So I always think about that with that gentle stimulation. If you're able to get it to happen, it can travel. And I'm thinking in a Chinese medicine is my overall picture, but I do think about like the Western brain, this kind of stuff. But that is my idea of working with that fascial pathway.
Another thing, what about, what's in your experience about cases which haven't gone so well for you?
Cases haven't gone so well. That's a great question. Because, you start treating somebody and they're not improving. And so in that case, sometimes I'll incorporate more herbs. Maybe I'll incorporate more lifestyle techniques. I've still found gathering the chi to be, in my clinic at least, a very effective way initially for people. But what can happen is people get stuck. You get them initially gathered, and then you start to soothe their memory, but then they're stuck. They're not progressing, forward. That's when I'll do another diagnostic workup and see, maybe I'm missing something. Maybe I did miss something in this case, and I have to go back. Just like I kind of blew through that one case because we're getting short of time. But in hindsight, I did a combination of heart 6 and kidney 3. I probably would have been better off because she had some more heat, done kidney 7. So there's always some kind of flexibility and things working, and sometimes I have to go back to the drawing board. It happens to me all the time. I'll think like, oh, this is doing well, but then they're kind of reverting back and continually getting triggered.
The write-ups of Holocaust survivors
Mm-hmm.
reprogramming with song and sound, etc.
Yeah.
The last note I read, which I think I read through,
Okay.
but they were very much about, look, we're trying this, we're not having miracles, but we're trying it. Certainly my experience of third generation Holocaust survivors,
Yeah.
I cannot say they've all done well. I've learned a certain amount.
Yeah.
I cannot say I had great experience of treatment over time with marvelous success.
Right. Yeah, and it's not, it's going to vary for each case and what's going on for the person, but typically what I've seen is if you stick with it and really continue in this kind of unfolding, things will improve. And that, because it's all that inherited trauma is basically that gene being triggered, that coded DNA, non-coded DNA being triggered, because it's like that memory being released under stress. So through soothing that, it should help to settle it down, and then you can work on that deep level. So, all right, so I think that's based. So I thank you for your questions. I want to thank you all for being here and sticking with us. This has been a great experience this morning. If you would like, I can answer more questions at the Singing Dragon booth. I'm supposed to be out there signing books. For those of you who had books to sign, just meet me out there and we'll put you first in the queue. And then I have those cards for you guys as well. So thank you so much. I really appreciate y'all coming today.